Chorley businesswoman who we've been following through her journey dealing with breast cancer.
Yes, Suzy was diagnosed last June after a routine mammogram. Since then, she's allowed our cameras to capture the highs and the lows from her surgery to shaving her hair.
Well, after months of chemotherapy, she's now having radiotherapy at the Royal Preston Hospital. She wanted us to be there to help improve general understanding of how this treatment works. Our correspondent Elaine Wilcox brings us this report, which includes pictures of that treatment taking place.
With temperatures at -4, it's a freezing start for Suzy Orr. This is day 6, going every day to a specialist centre at the Royal Preston Hospital for radiotherapy.
You know, when your alarm's going off at 5:30 and then you've got to de-ice the car, it catches up with you. So I'm back to where I was before, very tired.
So this is the radiotherapy treatment room. When you walk in, you go past the signs, controlled area. Tell us what goes through your mind and what happens when you're lying on that bed.
It is daunting, but you get an hour appointment beforehand where they sort of measure you up. So when you come in and you get on the bed's already sort of set for your measurements, so they can target the radiotherapy.
Suzy will be naked from the waist, but wanted us to film to take some of the fear away from the treatment and encourage others to get checked.
I know that women are actually going for mammograms because they've seen this. The message is getting through.
With radiotherapy, positioning is vital, targeting the area where her tumour was removed.
Suzy, that looks incredibly uncomfortable. Just tell us what it's like being in this position.
I'm very relaxed.
High voltage x-rays are used to destroy any cancerous cells in her breast.
So try and avoid taking any of those deep breaths in, just nice gentle breathing.
Suzy has to lie completely still, any movement and the treatment stops. The centre has this highly targeted equipment thanks to charitable donations.
The Rosemary Cancer Centre raised 1.6 million for a piece of equipment called surface guided radiotherapy. What that allows us to do is we're able to line Suzy up without using tattoos. Now, tattoos are something we used to use for our patients to line them up, but it's quite a psychological reminder of the treatment. It's an amazing piece of equipment, and we're quite lucky here to have 6 of these bits of equipment that have vastly improved the treatment for our patients.
Suzy's prognosis is good thanks to a routine mammogram catching her cancer early.
I had no lumps or bumps. I had no clue. If I hadn't had my mammogram, that would have been growing in me. Please, if you get invited to have a mammogram, go and have the mammogram.
Just days before Christmas, Suzy was emotional, ringing the bell to mark the end of chemotherapy. Today, she rang it again.
This is not just the end of the radiotherapy, it's the end of all my treatments, so I'll ring that bell blooming hard.
It'll be no surprise to anyone that you've already got plans, but this
was skydiving, doing it for Boutet Breast Cancer, so again, to give back to local breast care units. I think there's a space for you there.
I might be tempted because it's you.
No, there's no stopping me now.
Elaine Wilcox, ITV News, Preston.
Yeah, skydiving, good on you, Suzy. We will continue to follow Suzy's journey. More